If you just give us 2 seconds, we should be going live shortly. Good morning, good afternoon, good evening to all those who have joined. We are now live on Facebook. I am going to record. I'm going to record this session as well. All right, perfect. So good morning, good afternoon, good evening. I'd like to take this opportunity to introduce myself. So I am Dr. Akwi Asimbang, an interventional gastroenterologist, and I'm also the board president and co-founder of the Pan-African Organization for Health Education and Research. I'd like to take this opportunity to welcome everyone. I am very, very excited about our session today. So as part of our session preparation, so we've got fantastic speakers. Our moderator is going to be Derek Musole, who is a medical student at Copperbelt University in Zambia in Southern Africa. We will have Dr. Sandra Chen, who's actually a colleague with me at Brown University. And we will have Dr. Mucheng'anga, who's also a friend and a colleague. And it was interesting, he's based in Zambia. It was interesting as, we're prepping for this. I, reached out to him and we started chatting, and it turned out we had actually worked together about 10 years ago. I think it was when I was in Zambia, because he brought up some old stories that that we had about me and, going to pathology department looking for samples and stuff. And so, we definitely go way, way back. With Sonia, we actually, I think I realized the connection. I knew we were at Brown together. But then we've had mutual patients, and she's actually on call this weekend, and it's 7 o'clock in the morning here. So I am extra, thankful for that. And we're joking just before we started. Yes, pathologists do take call as well. So I'm going to hand everything over to Derek. Like I said, Derek Musole. Derek is a future pathologist, and I think part of his interest today is to try and convince some of us to kind of go over to the other side. So Derek, I will be in the background. Anya Avis Nobuth is a co-host. She's in the background as well. So if there's any sort of glitches, any issues, let us know. Questions can be put in the chat, in the Q&A. And for those who are on Facebook, feel free to send your questions on Facebook. All right, over to you. I am muting my mic and turning off my camera. Welcome, everyone.
Thank you very much, Dr. Ansoba. Thank you for this opportunity that you've given to me as a scholar of the Pan-African Organization of Health, Education and Research. Thank you very much. And thank you for joining us, Dr. Luchenga and Dr. Chen. Thank you very much for your time and for joining us. Yeah, welcome all to this program. This is a special POHES program, which is the journey of a pathologist. So today I feature renowned pathologists, two renowned pathologists, one who's based in Zambia and one who's based in the United States. So I'll go on and introduce our speakers for today. I'll start with Dr. Luchenga. So Dr. Luchenga Adam Chelenganga is a state forensic pathologist in Zambia. He graduated from the University of Zambia in 2004 with a bachelor's degree in human biology and also a Bachelor of Medicine in Surgery in 2007. And then Dr. Luchenga went on to work as a resident medical officer from 2008 to 2011 before he joined the Masters of Medicine program in anatomical pathology from 2011 and then completed in 2016 at the University of Zambia. Later on, he completed the clinical fellowship program in forensic pathology from the University of Toronto in Canada in 2019. Dr. Luchenga is both a forensic pathologist and also an anatomic pathologist. He formulated the forensic pathology policy in Zambia. He is an expert witness. He is also an honorary lecturer of pathology and forensic pathology, medicine and medical jurisprudence. He is a supervisor for autopsy-based research at postgraduate level. He is also the lead pathologist for the autopsy casework for COVID-19 cases in Zambia, and he is also a publisher in forensic pathology. Welcome, Dr. Luchenga.
Thank you so much, Solly. Thank you. I'm glad to be here.
Thank you very much. I'm now going to introduce Dr. Sonia Chen. Dr. Sonia Chen obtained her undergraduate medical degree from the University of West Indies School of Medicine, St. Augustine, that is Trinidad and Tobago in the West Indies. And then she went on to do her residency program, which was both in anatomic and clinical pathology in the United States of America at Brown University, Rhode Island Hospital, Providence, Rhode Island. And then she has 2 fellowships. She did her first fellowship in oncologic surgical pathology at the Memorial Sloan Kettering Cancer Center in New York, and then also did her second fellowship from Boston's Children's Hospital. She did it in pediatric pathology. Dr. Chen is an assistant professor of pathology at Warren Alpert Medical School at Brown University. She is the pediatric and surgical pathologist at Lifespan Academic Medical Center, and she is the director of pediatric pathology at the Department of Pathology and Laboratory Medicine, Rhode Island Hospital. I must say that Dr. Chenya is also my mentor under the POHES Scholars Program. She is indeed also a great inspiration to me. Welcome, Dr. Chenya.
Thank you so much. Thank you for having me. And I hope I can answer all your questions today.
You're most welcome. It is indeed a privilege and honor to have you today here at this program. So to start with, what is a pathologist? I would love to first answer that. What is a pathologist in your own words? What is a pathologist? What is the role of a pathologist?
I'm sorry, I didn't catch any questions. No, it went by just a little too quickly.
Oh, okay. I was asking that to start this program, maybe if you would be the first one to tell us what a pathologist is in your own words.
Oh, that's easy. In my own words, a pathologist essentially is the person who reviews specimens or organs to identify disease. Pathology is the study of disease and disease processes. So whether it be in either clinical pathology or anatomic pathology, this is what we're doing. We are looking at the blood, we are looking at the lung, we are looking at the liver, and then identifying if there is a disease process that's happening. Sometimes there's not, if we're lucky.
Thank you very much for that answer. Dr. Luchenga, maybe you would also love to add on top of that in your own words?
Well, I think that in a nutshell, a pathologist is a physician, is a specialized physician who examines tissue from patients. So doctors refer, surgeons actually get biopsies, or physicians get biopsies from patients of lumps and bumps and whatever it is that they can get, depending on the indication. And the pathologist is the physician that goes then and examines the tissue and comes up with a diagnosis, of course, given a clinical pathologic coloration, and then helps the physician to institute correct treatment. I think that's what I would say. I'll go further and say, being a forensic pathologist, I would then say that a forensic pathologist then is a physician is a pathologist who has that further training in the investigation of deaths that are violent, suspicious, and deaths that are natural, mostly, to determine the cause and manner of death. That's how I would define pathology, I think, and the forensic pathologist.
Thank you very much for that well elaborate answer. So you've talked of what a pathologist is, and you've gone further to also explain what a forensic pathologist is. So are there any other types of pathologists? What are the types of pathologists that are there? And could you briefly explain the role of each pathologist? Of course, you've already explained for a forensic pathologist. Dr. Mucheng'anga, please.
So pathology is a wide field actually, and I think its vastness makes it a very interesting career path. So you have pathologists who get interested in, for example, just examining brain tissue or neural tissue, nervous tissue. So they're called neuropathologists, and they get to see all the diseases of the brain that are biopsied. So that's number one. Then you also get pediatric pathologists. For example, Dr. Cheng, she's a pediatric pathologist, so she gets to deal with all the pediatric issues around pathology. Then you also get nephropathologists. So nephropathologists are pathologists who deal with kidney tissue or kidney samples mostly, and they're mostly specialized in that, and they'll deal with kidney only and make diagnosis for that. And then after that, you also have pathologists who deal probably with only the what I would call the heme pathologists. So they'll deal with mostly lymphoid tissue and blood. And then you also get what would, I hope I haven't left out anyone, but I know that then each system then gets its own specialty. So there are people that you call soft tissue pathologists. There are people who are specialized just in GI, so gastrointestinal system. There are GI pathologists. They only deal with GI pathologists. And now I'll let my colleague add on the other specialties that I've probably missed out in my listing of what other types of pathologists you see within the anatomic pathology group.
Sure. I don't think you missed anything so far, but just as an aside and really for historical meaning, you have to remember that pathology grew as general pathology. So many of the people who were my mentors were actually general pathologists. This means that they were looking at everything from the brain to the heart, to the lung, to the kidney, to everything. And from there was a reality that, oh, maybe people should be specialized or should spend more time in that field, because now we're seeing so many things in the brain. Now we're seeing so many things in the heart. And so at least my mentors were all general pathologists. And now I'm from the generation where a lot of the pathologists are specialized. And so I became a pediatric pathologist. But at heart, I am truly a general pathologist. Even in my practice, I actually see everything. And if it's something that I know that I have not been trained to sign out, for example, hematopathology, I may get a lymph node from a child. And in that lymph node, there may be lymphoma. And in that case, I'll say, you know what, I think it might be best handled by a hematopathologist who has spent an additional year looking at lymph nodes in children, as opposed to I, who have looked at tumors in children, but not necessarily only lymph nodes in children. And so this is where that divide of how variable and how wide and vast the field has become. It started off as general pathology, and some of the greatest pathologists were people who could put anything under the microscope and make a diagnosis. But now I fear that there are many people who can't do that, and if it's not within their scope, they want to give it to someone else who has been looking at this. But you're right, you can go from gastrointestinal pathologist to genitourinary pathologist to bone and soft tissue pathologist. I personally think of myself, when I'm a pediatric pathologist, as a generalist for a pediatric patient, because I will see anything from anywhere, and I should still be able to look at it and diagnose, or at least say, you know what, this is a tiny bit out of my skill set. I don't think that I have seen these many cases, so I'm going to give it to someone who sees these on a regular basis. So that, I think, is an explanation of like how we came to arrive at the number of different pathology specialties. And then you have to remember that there are some tissue pathologists. So the tissue pathologists are the people who are looking at the large organs, like the neuropathologists who look at the brain, the cardiothoracic pathologist who looks at the heart and the lungs, the hepatopathologist who looks at the liver, the GI pathologist who may also look at liver but looks at the gut. Genitourinary pathologist looks at the bladder, the prostate, and then you have the gynecologic pathologist who looks at all of the female GYN organs. Sometimes we even have breast pathologists who only look at breast, at least in our setting. And then there are the people who look at exfoliative cytology and cytology specimens. That's a cytopathologist. They do not look at whole organs. They look solely at the cells. They don't look at the architecture most times, because what they get is a urine or a scrape of something and put that on a slide, and that's what they review. So that's the cytopathologist. And that's only in the field of anatomic pathology. And I will not, neglect to mention, obviously, forensic pathologists who have a very challenging task that I partially got involved with when I was back home. I did quite a number of autopsies myself. I still do autopsy, hospital autopsy pathology. And this means that I still have to be somewhat of a generalist myself because I'm looking at everything anyways. But you can see that it's very easy to, once you can name an organ, there's probably a pathologist for that organ, basically. And then don't forget our clinical pathology fellows, because clinical pathologists do also quite a lot. We have clinical chemistry, pathology, people who just look at lab values and serologies and make sure that everything is working fine with regards to their machines. We have molecular pathologists who are very, very important in helping to make a diagnosis of a soft tissue tumor. And they will be the ones to say, yep, that's really a true mutation in this lesion, and this is what it should be characterized as. There are, of course, we talk about hematopathologists, and one more subset that I can't remember, like so it's not like pathologist, but there's a person who can be responsible for just clinical immunology, and they're usually pathologists as well. That's really very important, of course, when making a diagnosis of SLE, etc. Just to have somebody who has wide enough experience to look at lab values and say, hey, something's wrong here. This doesn't look right. We should talk to the treating physician and make sure that they know this is the case in this patient. So I think I summarized as much as I can the different types of pathologists.
Thank you very much.
Many.
So, Msole, just as an addition,
yes.
From a practical point of view, in Africa and in Zambia, mostly, all of us do everything. We are general pathologists, as Dr. Cheng says. We all do everything. So my colleagues and myself in this country, the 13 of us, all do autopsies. We all do cytology. We all do tissue-based biopsy diagnosis. So we're really generalists when you come and think about it, because we've spent more time being generalists than being super specialists. Yeah. So from a practical point of view, at least in Africa, as I know it, we all do everything. So in my daily work caseload, there are times when I do just biopsies and anatomical pathology, even though I spend most of my time doing forensic part because it's busy rotation. Yeah.
Thank you very much for those well and elaborated answers. It's really made us have a broad view about the types of pathologies that are there, because the notion that's there, especially here in Africa, let me just say Zambia, is that a pathologist only deals with dead bodies and autopsies, postmortems only. But now we can see that there's a lot of work that is being done by the pathologists in the lab. So with that being said,
you're not the only one who thinks that. Like I've worked in the Caribbean and I have worked in the United States. I have friends who work in Canada and friends who work in Australia, and everywhere, no matter where you are, a pathologist deals with dead bodies. So you're not alone in that thought. You have to. This is the opportunity we have for educating people.
Yes, and thank you very much for educating everyone on that. We're really grateful. So with that being said, what was some of the motivations that made you to choose the field of pathology, unlike other fields of medicine? Because for most people, they would either go the surgical way, they become surgeons, or they go the medical way, they become physicians. But what made you choose the pathway of being a pathologist, and at what point in your career did you make that decision? We can start with you, Dr. Chen.
Sure. I heard you say that if you did medicine, you become a physician. But guess what? I am a physician. So, and that's what Dr. Mucheng'anga said, right? We are still physicians. We're all physicians. We all went through medical school. We just chose a different path. That's not internal medicine or critical care or something like that. But I think the main reason why I ended up choosing pathology is because I liked everything. I went through every single rotation, and every single rotation was very interesting to me. I would be on my neonatology rotation when I was a medical student, and I'd be like, well, why does this baby have a bleed in his brain? What is wrong with his brain? Something must be wrong. And I would just, find the pathology in everything that I would see, from diabetic patients on the floor to the hypertensive stroke patients in the ICU. I was looking for the pathology, I think, and that interested me. I do enjoy learning about how each of these things, like the biochemistry, the physiology, and the anatomy, all interact to produce a disease. Like, this is really important and interesting to me. And I think that's the main reason why I chose pathology. I also thought that choosing one single field, I feel like you are the doctor's doctor. And in your knowledge and the things that you know, you actually can educate your colleagues. And I like that as well. So those two things, I think, made me go in the direction of pathology.
Wow, that's very nice to hear. But at which point in your career did you decide that you want to become a pathologist? Was it when you were a medical student or after graduating from medical school?
So in Trinidad, we are medical students, and then we go on to do internship for a year. And then following that, we can become house officers in different fields. And I kind of wanted to do pathology because I knew that there was a little more free time than some of the other rotations, because I had in my heart, my plan was to write my boards, my step 1, step 2, and step 3, and come to the United States. At that time, when I was in medical school, I actually thought I might do OBGYN for a little while. But then when I actually did the rotation, I was like, I am not going to be able to wake up at 3 in the morning to deliver anybody's baby. Sorry, like it didn't work for me, and it works for many people, but it's not mine. And so as a result of all of that, by the time I got to internship, I realized that I enjoyed or I liked the idea of pathology. I got into pathology kind of on a fluke because there was one house officer in pathology, he broke his ankle, and I was like, me, I want to be in pathology. So I fortunately got into pathology. And then I realized once I was working there as a house officer, I was in love. There was no alternative. I was like, this is the place for me. Look, I can see everything. I can learn about everything. I can teach my colleagues about everything. So to me, as soon as I started working in the field, I was a house officer by that time, but as soon as I started working in the field, I knew that it was for me.
Wow, that's really nice and inspiring. How what are some of the motivating factors that you had which made you choose the field of pathology? And at which point in your career did you also decide to become a pathologist?
So my story is very different. I was a committed stem cell from the beginning. I knew my lineage. So when I was in grade 11 at Mnali Secondary School, I I read a book by Professor Keith Simpson called 40 Years of Murder. After reading that book, I wanted to be a pathologist in my 11th grade in secondary school. Now that's very strange because I never wanted to be a doctor. I never wanted to be a physician. But at a very tender age, I wanted to be a pathologist. And it helped that I read the whole autobiography of this pathologist from the UK, a renowned pathologist called Professor Keith Simpson. And so I went into university wanting to be a forensic pathologist. So I started my first year, I knew I wanted to be a forensic pathologist in first year. I chose medicine because I wanted to be a forensic pathologist. And went through medicine, and when I finished my medical degree, so I'll tell you, when I finished my medical degree, I then did internship. But at the end of my internship, I went to the Department of Pathology and worked there for 3 months, waiting to be posted to some rural area to go and work in Mansa. So I wanted to be a pathologist that much. But most of all, I then went to a rural area and worked for 2 years. And in that time, there was a huge temptation to join internal medicine and obstetrics. And I had some of my supervisors calling me, asking me if I wanted to come to internal medicine or obstetrics. So Professor Vualika would be one of the people that really wanted me to come to obs and gyne. I said, I'm thinking about it, but I knew in my heart I wasn't thinking about it. So later on, I applied to come to get to anatomic pathology, which I did. And in 2016, when I graduated, so whilst doing anatomic pathology, I spent 50% of my time in the mortuary doing autopsies, because that's what I always wanted to do from a very young age. And so I got into a situation where I did an attachment in Toronto in 2012, 2013. And I went there to do anatomic pathology. But the day I arrived in Toronto in 2013, the first thing I did was ask Professor Ranjan Chetty, an anatomical pathologist, a GI path guy. I said, where is the forensic unit in this country? I want to see it. Then he said to me, but you are here for anatomic pathology. I said, I know, but I want to know where the forensic pathology unit is. So gave me directions, and 3 weeks later, I went to that place and introduced myself to the forensic pathology unit, which was probably 70 km away. I got on the train and went there because that's what I wanted to do. And then just introduced myself and spent a week there and came back and continued with my attachment at the Toronto General Hospital. But when I finished in 2016, when I finished my anatomic pathology in 2016, I immediately moved to forensic path, and through the connection I had made by visiting the forensic pathology unit in Ontario, in Toronto, I then applied for a fellowship, and Dr. Michael Polanen, Professor Polanen was gracious to grant me the opportunity to go and train with them for a year, do a fellowship with them for a year. So as I keep saying, I love pathology. I love pathology. It was my first love. I got into pathology, but I didn't know what I was getting into. All I knew was pathology was about autopsies, just like you guys. Pathology was about autopsies, about cutting up dead bodies. But when I did my anatomic pathology, I found out actually that one of my biggest attributes was visual. I was very visual. So every time I think of a disease, I see a slide. I see the gross how does a stroke look like? For example, how does a stroke look like grossly and microscopically? So, and my mind is wired that way. Every time I think of a disease, I see it in terms of the gross appearance and the microscopic appearance. So anatomic pathology is a very, very nice field. I actually fell in love with it whilst doing it, but I would not have ignored going into forensic path, because forensic path is what got me into medical school from the beginning. Thank you so much.
Thank you very much for that. That's really inspiring and really interesting. Thank you very much. So as you are pathologist, you're practicing pathologist. So what would it take for someone to become a pathologist? What qualifications should they have, or rather what attributes should they have in them for them to become pathologists? Maybe Dr. Chenga, you can start with that.
All right. So first of all, you must be a medical doctor. That's number one. So you need someone needs to be a medical doctor. After you become a medical doctor, you need to take further training, 4 to 5 years, depending on where you're training. If you're training in Zambia, it's 4 years, 4 years of your MMed or Master of Medicine in Pathology. In other places, I know that in the UK, they take 5 years to do the Royal Fellowship, the Royal College exams. So it depends on where you are. In South Africa, they will take 5 years. Ready to spend another 4 to 5 years for a master's or whatever it's called in different places in anatomic pathology. And then if you want to then go further and narrow down your field into just one thing, in many places, a fellowship is 1 year or 1 year, 6 months, depending on where you are. So that's what it takes to become an anatomic pathologist and later on specialized pathologist, specialist, super specialist pathologist. What are the attributes? I think that's what I need to talk about a bit more. So initially when you start, you think it's just seeing slides. So one of the attributes that I think is very important for a pathologist is to be very visual. You need to be a kind of person that sees pictures out of things, that sees things in 3D. So I find that has helped me a lot in making diagnosis in anatomic pathology, but also to be able to visualize disease. So you must have an attribute where you are very visual. You relate everything you see, you picture things. You're a picture kind of person. So you have to be very visual. Number two, you've got to be very hardworking. So as Dr. Cheng had said previously, we are, as anatomic pathologists, we are the last true generalists or general doctors, general physicians, because we have to know everything, a little everything about everything. So we have to know a little about pediatrics, or a lot actually, pediatrics, a lot about internal medicine, a lot about surgery, and a lot more about even other super specialist areas. So for example, the general as an anatomist, you need to know a lot about, for example, dentistry, the teeth and the tumors that come, the tumors that will come from teeth, or that will originate from the oral cavity, right? And that's a very narrow space, but you need to know about it. You need to know about orthopedics if you're going to report bone tumors and things like that. So you have to work very hard because you have the volume of things that you need to study and read are quite a lot. So you can't really pick when you're generally, because everything comes to your table, right? And you're working in Africa especially, where you don't have a place to refer your samples. So if you're in another place, you probably have the luxury of having a GI pathologist and a neuropathologist. But if you work in Africa, if you work in poor resource areas like here, you've got to do a lot of reading on your own, even as a specialist, not just as a student, but as a specialist as well, because there's literally nowhere for you to throw your slides. You have yourselves, you depend on yourselves. So you read through things, but that's the most interesting thing, because there are things that you don't know, then you read about them, and then you've got colleagues across the globe, and you send them the slide, and they give you their opinion, and you get going like that. So you have to be very proactive. You have to be on your toes, reading all the time. You have to be at the boundary of knowledge. You have to keep reading. Thank you.
Wow, that was very nice. So from there, we picked up about being visual, being hardworking, being proactive, and always reading. Thank you very much for that. Dr. Chen, would you love to add on that, what it takes to be a pathologist?
I think I just have one more thing to add, because I would echo everything Dr. Mucheng'anga said. The one thing that I will say is you just need to know how much you know. And it's okay to know that I don't know this thing and I am going to have to learn more about it, or I'm going to send it to someone else who sees it every day. And it's okay. As physicians, it doesn't matter where you practice, there will always be some diagnosis, some mystery diagnosis that will arrive at your door and you still have no clue because you've never seen it before. At least for the first time, it will be new to you. And it's okay to recognize in yourself, because sometimes I think as physicians, we feel, oh, we must know this answer. We had all this training. Why don't we know it already? And unfortunately, that's not how life works. So it's okay to know that you don't know and know what your limitations are and be able to say to yourself, I don't know this thing. I can share with my colleagues and I can share with others and see if we can get a better diagnosis for this patient. And I think that at the end of the day, if you're able to know what you don't know, you'll be safe. You'll be the best physician, because that's good for your patient, no matter where you are.
Wow, that was very nice and interesting to hear. We really learned a lot. Yeah, going further in life, like there's some things that we like about our work and some things that we don't like about our work. So looking into the field of pathology and with your experience as working as a pathologist, what are some of the things that you like about being a pathologist and some of the things that you dislike about being a pathologist? Dr. Chen.
I think I really thought hard about this question, because I felt at first there's nothing that I don't like about pathology. But I will say, so quite honestly, the reason why I like being a generalist is because I don't get bored. And this is the thing that makes me very happy and is one of the reasons why I love pathology. But the thing that I guess I don't like is the stereotype that people have of pathologists. I know people think, oh, every pathologist is an introvert, they're quiet, they don't talk much. And I think I'm probably not that person. So I personally don't like that. But really and truly, and even it's so systematic that your own colleagues may expect you to be that way. So when I speak out in a tumor board, people are like, the pathologist is speaking out? This is not normal. And I'm like, no, I should be speaking out. That's my duty. That's my job. And it's okay for me to get actively involved and become passionate about the thing that I just presented that's related to my patient. That, I think, that stereotype I don't enjoy. And that's one thing that I probably don't like about pathology. I really just love everything else. That's all I have.
Okay, thank you very much for that. How about you, Dr. Mucheng'anga? What are some of the things that you like and dislike about being a pathologist?
So I'll begin with what I don't like. I don't like being in the news. That's the first thing. So my kind of job, every time I listen to the news, I know what I'm going to get on my table the next day, right? So if I hear that someone has been shot dead, I know that's coming to me in the morning. But then when you actually work on that issue, you can't go anywhere public, because the people that know you, your closest friends, be like, so how was that case? How was that guy shot? What do you think is the cause of death? I don't like that. So I think that's one of the things I don't like. I don't like the idea that half the time when I go to a social place and every time someone knows I'm a pathologist, the next thing is, so how did that case go? Things like that. I don't like that. So that's one of the things I dislike about pathology. What I love about pathology, especially now, my profile of work now, is that every day is different. I'll tell you. every day is different. I spend a lot of my time teaching. That means that every day I give guidance to physicians. So most of the times I get a lot of maternal deaths that come from various hospitals around Lusaka into our autopsy room. And so I'm able to guide the physicians who are treating these mothers and children about what the cause of death are and some of the effects of the treatment that was given. But number two, I'm able also to guide detectives. So these are police officers, right? So police officers who come in and the questions about homicides or criminal matters. And also the idea that I'm able to guide prosecutors, right? People in court. I'm able to guide the judge and the jurors, and also guide public health officers. So one of the most interesting things I think in the last 1 year has been the fact that I've been involved in a lot of COVID cases, COVID postmortem cases. That has been very fulfilling for me as a pathologist, because I've been able to see firsthand the things that clinicians don't actually see on the patients, because they don't have the opportunity to open up and see themselves, right? See the thrombosis for themselves, see disseminated thrombosis throughout these COVID patients that die in hospitals. So that has been one of the, truly, it's sad that people die, but from a professional point of view, it's very fulfilling to be able to look into a new disease and get insights into a new disease by doing many, many cases. And we're blessed in Africa that we're able to see so much of these cases. We're able to do autopsy work for this very novel disease and probably see the spectrum of this disease and how it affects various organs. Thanks.
No, indeed, we're really learning a lot about pathologists and the work they do. I'm sure by now most people are having an interest in specializing in pathology. So those that are joining us, whether from Facebook or through the Zoom webinar, you can, if you have any questions or contributions, you can add them in the chat box, and for the questions in the queue, and we'll deal with them at the end. So for most people to choose a career pathway, one of the factors that they look at is how well-paying that field is, and in what ways can they make money when they specialize in that field. So looking at this field of pathology, how does a pathologist make money? And do you feel like pathology is a well-paying field? Dr. Chenga, maybe you can start with that.
Well, so I can say from my experience, both in the Caribbean as well as here, the pay is much better in the United States. However, one would have to also recognize that the volume of cases and the expectations of what you are getting done is also increased in the United States. Because the society is quite litigious and you want to make sure that you cross all your T's and dot all your I's, and you have the ability to do all of those things. Because back home, if I were in Trinidad, I might not have all the immunohistochemistry to make a diagnosis that I would have here in the United States. And as a result, if I didn't do the immunos back home and I made a diagnosis, then that's what it would be. And I wouldn't be in trouble because I have only what I have available to me there. But if I came to the US and I did the same thing, and I know that in my laboratory I have all the things that are required for making the diagnosis, I would get in trouble, right? If I just signed it out without the immunos or whatever is the standard of care for making the diagnosis. So certainly the scale of pay is much better in the United States. I will tell you that there are certain areas of pathology, people who get paid more, people like neuropathologists, sometimes cytopathologists. If you work in a public setting, meaning a university setting, also you get paid less than if you were working in a private practice, or if you were working for a huge company that is sort of like a biopsy mill, and all they do is look at biopsies all day. And that's really up to you. I came from a setting where, you know, back home, people do not have insurance. People do not have the ability to get every single mode of care that is available to them because we just don't have the opportunity or the capability in the country. And as a result, I feel like, you know, I have to give back. So quite honestly, once I'm safe with my salary and I can manage from month to month and taking care of my family, I'm okay. I don't need to make a whole lot of money. Pediatric pathologists, I'll tell you, are not at the top of the ranks for making a whole lot of money either. You can negotiate your salary while you're in the negotiate, so it's not fixed. So that can also help you make a little more. And of course, like, you know, the places where you go, if they're really in dire need of you, they may pay you more. But if they're not, they won't. So that's also, I mean, there's no good way. There are also people who do side jobs. I have friends who they take histology prints and they make a shirt or pants or a tie or something, and they sell that on Etsy. And that's how they make side gig money. I don't do that, but that's like an alternative way of making revenue from the things that you do every day. And I think those are the options.
Okay, that's very interesting. At least we've learned a lot. How about Dr. Mucheng'anga? Would you take that on, please?
All right. So, money. I'll tell you, in Zambia, the caps for salaries for medical doctors are very defined. So most of the doctors are employed in the public sector, and pathologists clearly are employed in the public sector. And I'll say that as much as all pathologists will be in the N scale. So that's the consultant scale. The consultant scale of the salary is the highest in the government amongst all civil servants. So it's not all doom and gloom. So the money may not be enough when you calculate it in dollars, but it's enough for you to live very comfortably. Not like an NBA superstar or a soccer player or a footballer, but it's comfortable. So you can afford to drive a good car, buy fuel, feed your family, and take your children to some good school. Number two, so what are the avenues if you want to just make a little bit more money? So pathology has a lot of components to do with research. So one of the ways in which I would make extra money is by being involved in a research grant. There's a research grant, you get involved, you just get a bit extra money by doing that. And the advantage with that is that you don't get out of your office. You make money in your office. So you don't have to walk out to a private hospital. You sit in your office and do consultation and make money like that. So that's one of the ways in which you make just a bit extra money. The other way in which you make a bit of extra money is by consulting with, so for a forensic pathologist like me, most of the money will also come from consultations from the criminal justice system. So whenever law firms or lawyers are representing people who are accused or in cases of murder, they will mostly ask for an expert opinion, right? What do you think about this? So that is great money because it takes you an hour or two to write, but the money is great. So the money is great on expert witness consultations. There are a lot of them. You always have 2 or 3 every week. So that's fine for forensic pathology at least. So that's one way. So the criminal justice system gives you just a bit of that. But also there's a lot of private practice around autopsy work. So most of the times there are cases, there are deaths that occur that don't fall within the criminal justice system. And yet the families want to know why their loved ones passed on. They want explanations, they want answers. That as well is is very money making, I should tell you. It's huge. People, and this is because in Africa, when we die, we want a reason why someone has died. There's always finger pointing and accusing someone. So what has happened now is that there are a lot more requests for private autopsy work, for private autopsies. And so that is another way in which you would make a bit of money. So I'll tell you, over a weekend like this, I could do something like 3-4 private autopsies on a weekend, you know? And so there are ways to make money, aside from the fact that as a pathologist or a forensic pathologist, you are employed in the highest bracket of the salary scale for civil servants in the country. But you actually do get side jobs, and they don't take you away from your work. You actually work within your office space. So I don't have to drive 10 kilometers, right? Or 20 kilometers to go to another place to go and work. I sit in my office, do my work there, but mostly the money is there to be made. If you want to make money, you will make it. But I'll tell you, you've got to work very hard for opportunity to see you. So people won't come to you just because you're a pathologist. People want to know that you are good at what you do. People only give you work if they know you can deliver and you're good at what you do, and you're going to give them work that is independently reviewable. Yeah, so we're not that poor. That would be my concluding statement to that. We afford the basic things.
Can I also add that we do also do consultative work, but because of the clause that we sign as a part of our contractual obligations, that money doesn't go in our pockets. It goes to our research fund, or it goes to a consult fund where we can spend that money for books if we need them at work, but we can't keep that. It doesn't get taxed. And there are places where that does not happen, but at Brown, the money tends to go directly to a consult fund or whatever. So you don't get like paid privately for whatever you do. But I do have colleagues who have private, they do private autopsies and that kind of stuff on the side as a side gig. I cannot participate in those because of my contractual obligations, but it is very lucrative, I've heard.
So it's really important to understand the types of contracts you have with your institution. Yeah, thank you very much for that. So Dr. Chen, knowing that you've done your residency program in both clinical and anatomic pathology from the United States, you've also done your 2 fellowships from the United States, while you did your undergraduate program from the West Indies. How would you compare, how was your experience having trained from the United States, and how would you compare it with training from your home country?
So I am completely biased to my home country. And I believe that our medical schools back home do provide us with the well-rounded knowledge that you need to become a pathologist, one, or that you need to become a physician in general. Quite honestly, when I was an intern on the floors, I was managing patients with diabetes and hypertension. This is before I came to the United States. I was an intern back home, and I was able to manage any kind of patient, write scripts, do everything that physicians here do only after they've been handheld for a couple of years doing internal medicine or something. And for me, that has also provided great insight in becoming a pathologist, because I could speak with clarity and knowledge that, hey, I have managed patients, I have put in IV accesses, I have put in JVPs, like, I know what you're talking about, and I'm not, just a pathologist in a box and all I've looked at is slides all of my life. And that has been great experience for me to be able to express to my colleagues here. So I am quite biased that the education system in the Caribbean actually is slightly better than what is experienced here. I do tell every medical student that I meet, do not take for granted the opportunities that are available to you. So in the US, medical students do get exposed to quite a lot, but they can and I personally feel that's what happens, they can get routed in one direction and go to the subspecialist area that they're very interested in without seeing the whole picture first, which I think is vitally important for every physician. You have to understand how things work before you can go to that subspecialty, right? And I think they kind of get pigeonholed there because in the beginning, they know this information. They think they want to be an ophthalmologist and all they pay attention to is ophthalmology. And they forget that there's a huge picture out there of what's going on, before you get to the point of disease in the eye, for example. So I think that's my personal bias, just that the medical schools training is much better. Of course, in the United States, the opportunities are what you make it. There are lots of opportunities. You just have to grab each one and be determined to do so. And that's what I have done, I think, for most of the time that I've been here as a trainee. Simply, as you know, when I first started at Memorial Sloan Kettering Cancer Center, one of the first things I did, I knew that I wanted to do some bone and soft tissue pathology. I introduced myself to the people who were doing bone and soft tissue and said, hey, I'm here for a year. I would really like to work on anything you have. I am willing and I will give whatever time I have in the evenings, whatever. I know this is a tough fellowship, but I am willing to work. And I was able to get 5 publications out of that 1 year. So you can do it. You just have to put your mind to it. It's not hard. And that's all I have to say.
Wow, you managed to get 5 publications in a year. That's really nice. That's really inspiring. Yeah, but from your experience training at both levels, residency and fellowship levels, what are some of the challenges that you faced, and maybe how did you easily overcome them? Or how did you overcome them effectively during your training at all the levels, your residency program and also your fellowship program? How did you overcome your challenges, and what challenges did you face?
I think that there were 2 major challenges. One was there's a lot of new information for me because practicing in the United States and practicing in the Caribbean are 2 different things. So there was quite a lot of information that people expected me to know. And I was like, I've never seen this before. We don't do this back home. We don't have this available to us. I can't tell you that I've seen all of whatever you're talking about because I've only read about it in books. We diagnose it in a different way. So I think that just took reading and learning new things. And sometimes that experience can be frustrating because you feel like, oh, I did all this stuff and I kind of know things, but obviously while I'm here, I don't know how people do it here, if that makes sense. So that was quite frustrating for me. I also felt like the issue of race came up a number of times because I had been stopped multiple times in the airport and people asked me, what are you? From security guards to just random people like checking my suitcase. And because I am not everything they expect when they see the surname Chen, and because I'm from a multicultural family, that was also quite a shocker. Back home, we do not have this question. People like me exist all the time and they don't care what your surname is, whatever it is. But here, that issue of race was very obvious to me. And I think, no matter what you do, it's kind of like everywhere, but it sort of still follows me no matter where I go. As soon as people see the name Chen, they expect to see a very Asian looking woman. And then when they see me, they're like, what? They don't understand. You do not make sense in their heads. So it takes a little explaining what my cultural roots are, where I came from, all of the different nationalities that I comprise to come to look this way. And that sometimes it can be shocking. The first time someone asked me, like, so did you marry someone with the name of Chen? I was like, no, this is my surname. I was born with this surname. My grandfather was from China. It just was a cultural shocker to me, especially coming from the Caribbean, where people are of all different backgrounds, and it was not blatantly obvious. People certainly didn't walk up to me asking me, what are you? So that was also, I think, a challenge for me. And overcoming all of these things is just time and experience, quite honestly. You learn how to develop a better answer. You learn how to smile and sort of shrug it off and be like, I know you don't understand. Let me explain this to you. And be the best educator that you can be when it comes to that. I think those are the main things. And then during, residency and fellowship, there were always issues between education and race, I think. But with every step, and the more you sort of gain experience with that, it was easier and easier for me to explain, oh, I look this way because these are the things, like I was able to overcome most of those things. Yeah.
Well, you really stayed strong through it, and then now you are here. So that's really inspiring. Before we move on to Dr. Mucheng'anga, I don't know if you can still add on to the fact that you did 2 different fields of pathology in your residency program. You did the clinical pathology and you did the anatomic pathology. So how was that for you? Was that challenging to have to do 2 different fields? And do you think it's more of an advantage than only doing, let's say, anatomic pathology alone in the residency program?
It's a combined program. Most programs in the United States are actually combined with anatomic and clinical pathology. So they make it such that you spend a minimum of 18 months on each field, and the remainder of the time that you're there, because it's a 4-year program, the remainder of the time that you're there, you can combine AP and CP. It's really not, of course, you're learning new things, but it's really not super challenging. When you go to microbiology, you spend time going through microbiology and you learn microbiology. My personal, belief is that whatever you do, you throw yourself into it and do it to the best of your ability. Because, and I know myself, I knew that I wasn't going to become a microbiologist, but I also know that I need to know that information so that if I have something that's related to that in my autopsy, for example, I should have at least a baseline knowledge that I say, hey, I need to involve a microbiologist on this. So in that regard, it wasn't very challenging to switch between anatomic and clinical pathology because it is built into the program. There are some programs that are completely anatomic pathology only, and those are 3 years. And there are some programs that are completely clinical pathology only, and those are 3 years. The only one that's a combination of the two is 4 years long, which is anatomic and clinical. So it's not too bad.
Thank you very much for that. Dr. Mucheng'anga, now we've come to you. You did both your undergraduate and your Masters of Medicine in Pathology from Zambia. So how was it having to train from Zambia? What was your experience training from Zambia? And you further went to do your fellowship program in Toronto, Canada, University of Toronto in Canada. So how does your experience working from Canada and having to train from there compare with the experience that you had in Zambia?
Thank you for the question. So training in Zambia, especially in medical school, is quite rigorous, and I think there's a lot of information to get around, and so medical school is always a challenge. I think that's one thing that we all know. You pass some tests with results that with marks that you're not very happy with, but it's the way it is. You move on. That's what it is. And then my master's at master's level is where I think that a lot more needs to be done, especially in terms of research and publications. So I think there's a bit of a challenge when you do your master's here, especially in terms of exposure to others. My group was a bit fortunate that we had attachments. I think one year of the 4 years was spent outside the country. So I did another 6 months in Toronto when I was doing my master's program in anatomic pathology at the Toronto General Hospital, and then I did another 4 months at the Aga Khan University in Nairobi. So that gave me probably a good picture of the practice in Africa and the practice in the developed world. And I'll tell you, I think as as Professor Cheng has indicated, when you are from a developing country, there's what we call the advantages of disadvantages. So we tend, and this is my experience, we tend to have a lot of information. We tend to be generalists, and we tend to have a lot of information, but we do poorly when it comes to technology, for example. So reading a CT scan. So you have to struggle with the CT scan issue when you're training abroad, because it's not available in Zambia when you're training as a medical student, and most of all, even when you're training as a postgraduate. So it's available for very sick patients, but not available to all of you. It's available in radiology, but not all of you. But it's an advantage that you already are used to getting a lot of classifying it and knowing where to put what. So it makes the learning much easier, I think, when you go out there. What did I learn from Toronto? What was the difference between my postgraduate training here and in Toronto? I'll tell you, forensic pathology especially is different between Africa and is different in Africa and the West, mainly because our disease patterns are different. The way the crimes are committed are different, right? So you're very different. But one of the things that you appreciate is that the fellowship or training abroad teaches you how to think around things, gives you the principles, as with what our education should give you. It should give you principles on how to think through things. So it was different. It was challenging. I think one of the biggest challenges of me going to Toronto was the cultural shifts. I could not make it when people are actually joking or when they are now very serious. English is my second language, and believe it or not, people speak English very differently. I have to think in my vernacular language and then probably translate it in my brain and then speak it in English. Whilst for other people it's a first language, they were born speaking English. So it obviously gives you a very big challenge. It's a very big challenge, but it's okay. You survive it, but it is a big challenge. I remember not knowing, like failing to really pick when my supervisor is not happy about something, because they look the same, I couldn't pick when I had done something that I was not supposed to do within fellowship, right? So the first 4 months were horrible because it's difficult to read the faces, right? So that cultural shift is huge, and it can be very disturbing the first 4 months. But I mean, the people are very kind, and I tend to notice that because they train a lot of people from outside their country, they tend to know that there's a cultural difference between the person that we're teaching now, the person that we're instructing now, and our local and our normal Canadian fellows. So they were very kind to me, and I think they understood that there was a very huge cultural shift. Also, just the idea that you're the only Black person in the program, like, so I'd never experienced that kind of a thing where I'm the only different person. I'm used to Zambia where we are all looking the same. But you go to a different place, you're the only different person in there. But I'll tell you, the learning that I got from that place was tremendous. The guys are great. They taught me well. I'm very, very grateful. I'll forever be grateful that they taught me the principles that I continuously use up to now. And it is my desire that we get that education from the West and come back to our country and then try to improve systems here, which is what now I'm trying to do. That whatever I learned, I try to put it within our context as Zambians, within our culture as Zambians, and try to improve the system here. And this is why I've been involved greatly in redefining how we do forensic pathology and policy at government level. It's because of that exposure that I had there, which which I think is still very valuable. Thank you. I hope I've answered your question. But I want to say one more thing, that talent alone is not enough. I'll say that again. Talent alone is not enough. So I'll tell you, there are many brilliant people, but to get through an MMed program, especially in Zambia, takes tenacity as well. Takes hard work, takes tenacity, and most of the times, because at the time you're doing your postgraduate, you're married, so you've got other competing needs of marriage and family and education. And so, apart from the fact that you are a brilliant human being, your IQ is above average, you also need to put in the work. Like, you have to put in a lot of work. But even when you finish, even when you are done with school, you still have to put in a lot of work, as you've seen from Dr. Asobang, Dr. Cheng, and myself. We are all putting in a lot into what we do, even over the weekends. So we don't rest because now we're done with school and education. We're still putting in a lot to make sure that we are continuously improving our skills. Thanks.
Thank you very much for that. Maybe before we go any further, we can take some of the questions that have been asked. Maybe we can address them. The first one is for Dr. Chen. Dr. Chen, please, in simple terms, tell me about cellular adaptations to stress. And then the next question is also, have you seen the TV series House? And if yes, was he a pathologist? I don't know if Dr. Chen, you can take those questions for now.
Cellular adaptations to stress is an entire block in probably in medical school. So I'm going to skip that question only because there's quite a lot of things that one would have to disclose, and I don't think we have enough time for that. But for the second question about House was not a pathologist. He was an internal medicine doc, and he did some pretty unbelievable things in that series, in that he was forensic pathologist, he was scene investigator, he was microbiologist. He's not a real person. There's nobody that does all of those things. Nobody goes to the scene of someone's home to check and see if they have some esoteric drug in the drawer of their bedroom, and then comes back to the hospital and says, "Aha, I found it. That's why you're sick." Nobody does that. We all utilize the information that we're given from patients and families once they have been interviewed by, whoever the attending physician that admits them, usually through the emergency department, etc. And, we talk to the clinicians and we figure out what's going on, but of course we cannot go invade people's homes to identify causes of disease. That's all I have to say.
Yeah, thank you very much, Dr. Chen. I think that has answered. Another one for Dr. Mucheng'anga is, what are odontogenic cysts and tumors? I don't know if you can take that one. And also for Dr. Mucheng'anga, are there any mentorship programs in Zambia for medical students that are specific to pathology?
Okay, thank you so much. Let me begin with mentorship. Did you say mentorship programs?
Yes, mentorship programs.
All right. Okay, so in our department, where we do forensic pathology, we consider ourselves as educators and researchers. And at all times, we always have a student attached to our department. So, like I said, anyone who wants to come through, to come and sit with us and learn what we do, they are most welcome. So we have nursing students, students who are doing forensic sciences. We've got medical students who come through, and I think I've seen one of them on the attendance list here, who was with us for some time, I think for 2 months or 3 months. So indeed, all you need to do is just write us a letter. We do not reject. There's no rejection. When you apply, we'll give you a time, then you come. So, and that is because we have very few pathologists in the country. And so we would like to get the word out and to encourage medical students to come through to our department and see what we do. And that is part of the reason why I go to teach undergraduate students, because we are looking for the next pathologists after we are done. And that the only way to do that is to go out there and interact with them. So they are mentorship programs. If you come through, we are very, very one-on-one. And especially from a forensic pathology point of view, we want people to join forensic pathology. We want people to become forensic pathologists in this country. For your own information, we are going to start training forensic pathologists, I think, next year in this country. So for those who are actually interested in doing anatomic pathology and forensic pathology, I should say that there's no running away from anatomic pathology. You have to do anatomic pathology before you become a forensic pathologist. So we are trying to do something about that. So next thing, odontogenic cysts. I'll tell you.
Sorry, maybe before you move away from the mentorship, do you also know of any other mentorship programs in Africa, not per se Zambia only, because you've talked of Zambia? Do you know of other programs in Africa?
So I know of a mentorship program that is being run by Dr. Kabwe, Jane, and Dr. Katie Njolo. They are running what they call Yes Zambia Young Scientists. Yeah, and they are mentoring a lot of students. And one of the things they do is they pair students, medical students, to specialists. And I know that last year they gave me about 6 students from the University of Zambia to mentor, and we went through that. And now I think they should be finishing their medical school this year. So other than that, I don't know anything else outside Africa, outside Zambia. But I know that there's the Yes Zambia Young Scientists group that does that mentorship, because they bring their scholars to me to mentor. So that's one. So let's go to the academic question now. Odontogenic cysts versus odontogenic tumors. So I do not have fine knowledge. I will admit I'm not an oral pathologist, but what I will say is that these are tumors that arise from odontogenic tissue, or tissue that is related or comes from teeth. Okay, so there are those that are cysts, and there are those that are solid tumors, like solid masses. So cysts have probably a cavity inside them, and the tumors probably are solid, depending on how you want to define it. If you want to be very strict, any swelling is a tumor. So these are just tumors or cysts that are arising from tissue that makes up teeth in the embryologic period of life. Thank you. Again, that's not
They're
fine
pretty common
data.
in kids.
Yes, and that's not fine data. That's very rough data.
All right, thank you very much.
Thank you.
Yes, maybe we can take the last question in the Q&A. I have a question for both Dr. Chenga and Dr. Chen. Has there been a time during your practice where you felt your report, for example, forensic report, is at the verge of compromise in a case where it is of public interest, and maybe a government official or important person in society may be implicated once your report is shared? And for Dr. Chen, how do you maintain life? How do you maintain a work-life balance as a woman in a very demanding career? So I don't know if Dr. Chen, maybe you could start with that.
Sure, I can address both points, both questions. So the first question, if there's an individual who's of public interest, typically our reports will become public knowledge, and there's nothing that we can do. I do, you know, if it will compromise this individual, you may couch the language however you want, but your job is to report what you see and be objective as possible. So you know, you basically explain exactly what you identify in objective terms, and if that's how it lines up, I mean, that's the way you've got to state it. Unfortunately or fortunately, we cannot make things look pretty for the sake of the individual. You know, you report what you have, and that's what you should be doing as a physician. And then the second thing, in terms of managing work-life balance, it is challenging. I will say, I have an almost 2-year-old right now, and I am trying to be very academic and productive, etc., and doing multiple services like autopsy. I do, as I mentioned, do general surgical pathology as well as pediatric pathology. So I do have a full plate, because when I'm at work, I am surgical and pediatric pathologist, and when I am home, I am mommy. So I definitely have a whole lot going on. But you know, as I said in the very beginning, the thing that I like to do is to throw myself in full-heartedly in everything, and I try to do that for both areas. I can't give more to my work than to my son and to my family. So I just make it work. And I decide when to say no. That's a really important thing that you have to learn for yourself. If you know that you want to get a paper done, you have to say, I cannot go outside to play right now. I'm going to have to work on my paper. But if you know that this is the only time that you're going to see a child and you're going to play with them, you know what? You got to hold on and say, listen, I can't do this paper right now. I'll wait for it. I might stay an extra hour after work and I'll do what I have to do. But I need to spend time with my family, because I think if you can't come home and be happy, there's no way you're going to be happy at work. And that's what I do.
Thank you very much. Dr. Mucheng'anga, do you have a take on that?
I think I had a different question. What was my question?
Your question was for how would you deal with cases which are involving important people in society? That was
All right. Okay. The standards are the same. So, can you hear me now? Hello? Okay. So, I was saying, in the work that we do, every client is important and we treat them the same. And I said, and the reason for that is because when we go to testify as expert witnesses, the standard is the same, whether it's a VIP, a very important person, or a poor person. But let me first of all address the issue of officials, VIPs interfering in our work. We are fortunate in Zambia that no one interferes with our work. It's very, very strange. But I have worked now, this is my 5th year in forensic path. I have not on one day ever been asked to say, why don't you write this in this report? And I'll tell you, I have investigated deaths that occur in police custody. So these are people who die in police cells. And the stakes can be very high. Everyone is very anxious, but not one day have I ever received a threat on my life or someone comes and says it should be reported this way. Never. And the reason for that is about professionalism. So how you carry yourself as a professional makes people approach you for dubious things. So if you portray a figure that allows people to ask you things that they know are not in your professional values, they'll ask you things, they'll ask for favors that are not in keeping with your medical ethics and with fairness. So forensic pathology, the tenets of forensic pathology are that we seek the truth, however painful and however discomforting and whosoever it may hurt. The truth in forensic pathology is what we seek. So when you train as a forensic pathologist, one of the first lessons you learn is that we are here to seek the truth. We do not, our duty as forensic pathologists is to the court, is to help the court adjudicate on issues of justice. And so the only thing that we do is do the correct thing, do the work, make sure that our work is independently reviewable. So it means that when I conduct an autopsy, they should be able to bring another pathologist from South Africa, from the UK, or from America, and they should be able to follow my work and be able to come up with a conclusion, a reasonable conclusion as to the cause and manner of death and how the death has come about. Now I'll tell you, in forensic pathology, our danger does not only come from VIPs. We are in the middle. So we deal with the poorest of the poor and the richest people, and they all have their own agendas to push. However, your harm can come from the community. So when people lose a loved one and they believe that the person has been murdered, and you say that the person has not been murdered, the person has died a natural cause, that can be very offensive for them. And they can get very angry, and I've seen it before. Same thing with government institutions. When someone dies in prison, for example, or in police custody, or at a training center in a military school, and they've been beaten, and your cause of death says they've died out of a blunt impact trauma due to assault, it can be very offending to systems, you understand? But those systems have never at any time come to me as a forensic pathologist and say, oh, Dr. Mucheng'anga, can you please change the way you present this because it doesn't sound well? No, it never happens. So as an interesting case, there was a case of a young boy who was shot dead during a riot in Lusaka. And in one of the court sessions, I was asked a question to say, you work for the government, you are a state forensic pathologist. We think that you are defending the state because the state agents, meaning the police, are the ones who shot this boy. My answer is always, and has always been, and this is what is true to my heart, that I am a physician. Above all things, I'm a physician, and there are medical ethics to abide by or to observe. So in that, those medical ethics are that one, I search for the truth and the truth only to the best of my ability. And when I make a mistake, it's because I'm a human being and I can make mistakes. And I'm not making mistakes I'm not making errors of omission deliberately. So it is important above all things that we remain very professional. And when you remain professional, no one will ever come to you and ask you to change your report because they know who you are. They know you've got a character that is professional. So it doesn't happen. It never has happened.
Okay. Thank you very much for that. In view of time, we'll take the last four, we'll go through the last four questions, which are quite cardinal, and then like maybe your responses could be in brief. We'll start with you, Dr. Chen. Are there any available funding opportunities for people that would love to specialize in pathology? Maybe that which you know from the United States or anywhere, even in Africa, if you know of. And what general advice would you give to someone who aspires to be a pathologist? Someone like me and some other people out there, and some who might want to specialize in pathology. What advice would you give to them?
So first, there are many funding opportunities for medical students, residents, and fellows if you are in the system already, but many universities also sponsor medical students to come to various rotations. You can probably find a list of those on that wiki website that I shared with you before. So I won't dwell too much on that, but there are many opportunities out there. You just have to look for it. So that leads me to the second point, which is if you are an aspiring pathologist, the most important thing you need to have in your armamentarium is determination to become what you want to become. Once you set that in your mind, nothing can shift you from that goal. And then you can, you simply have to put things in place where you know that this is what you're going to do and you have to follow through with it. This is just what Dr. Mucheng'anga said that he did, learning from a tender age of 11 that he's going to become a pathologist. He put things in place to make sure that he got to the place of a forensic pathologist. And I think that's really the key to you being able to, you being able to become a pathologist. And with that, I have got to run because I'm on call and I gotta answer a phone call. But it was a pleasure speaking with you and with Dr. Mucheng'anga. And I just want to make sure that if you need anything, Derek and Akwi, feel free to share my my email address, etc., with anybody who's interested and has more questions. And I'm gonna run away. Okay. Thank you.
Thank you very much for your time, Dr. Chen. I really
Thank you so much, Dr. Chen. I know you're on call, obviously. So, on behalf of Poor Hair, completely appreciate you spent a lot more time than we had planned. So totally appreciate your time. We'll carry on with Dr. Mucheng'anga if he has time, and then we'll definitely wrap up pretty soon. Thanks a lot, Dr. Chen, and have a great day. Dr. Mucheng'anga, if it works for you, I think there are like a few more interesting questions that came. If you have a few more minutes, would that be okay with you?
Yes, let me take four questions.
Okay. All right. Perfect. Yeah. Thank you.
Yeah, thank you very much, Dr. Mucheng'anga. Are there any funding opportunities that you know for people who aspire to be pathologists? Just maybe within Zambia or Africa or anywhere else that you would know of in the world? And what general advice would you give to people who aspire to be pathologists?
Okay, thank you for the question. So funding opportunities. So I know that the government of the Republic of Zambia actually funds training in pathology. That's one thing I know. And if you do your rural posting, you should be able to qualify for that kind of funding. That's number one. I also know of a funding opportunity internationally, but that's for forensic pathology after someone is already an anatomical pathologist. So yes, there is, but that's for super specialist education. That's all I remember. But I'll say one thing: if you really want something, you will get it. So I'll give you my story. I did not know anyone. I got my funding because I pushed for it. Now, you need to be very proactive. So if you are looking for something, if you are looking to become, for example, a GI pathologist, you will need to find the GI pathologists around the world and then talk to them, try to engage them, try to make yourself visible to them. That way, they will connect you to people who are funding for that particular kind of training. And I think that is the way to go. Be very proactive. If you want something, show that you want it, act on it, don't procrastinate. Be very proactive, engage people, and all will be well. And then just tell me what the next question was.
The question, I had asked two questions. You've answered the general advice you would give to, I think you've tackled all of them. It was the advice you would give and the funding opportunities that would be there. Yes, but knowing that you have this good educational background and you have very much experience in doctors aid more outside the country than in Zambia. So what motivated you to decide to work from Zambia instead of outside Zambia? And if you're comfortable, would it be okay for you to tell us the salary scale for doctors in Zambia?
All right, money again. Okay, so when you finish, and I'll talk for pathologists, when you finish as a pathologist, where you get into the end scale, that's the, so the government operates a single salary scale system. So everyone goes from, so the end scale is just below the permanent secretaries or the controllers of the ministries. And then, so it means that you as a pathologist are above the directors in government, in the government of the Republic of Zambia, right? Now, how much money is enough is a very personalized issue. So there are people who want to live like NBA superstars or soccer players. So that money won't be enough. There are people who live modestly. You can afford a holiday. If you ask me, can I afford a holiday? Yes, I can afford a holiday. Yeah, out of my savings, so I can save some money and go for a holiday. That's okay with me, right? Why you're saying that other doctors outside the country earn a lot? So 1 for 1, that is true, but the cost of living as well is very high out there. So a shirt that you buy for $2 here in Zambia will cost you $200 there. So there's also that aspect that people don't look at. But there are also other advantages of you working in Zambia. For example, it's much easier for you to, so I'll tell you, there's no competition in this country. I'll be very honest with you. Zambia is the easiest place to make it. If you go out there, it's very difficult, first of all, to even get into medical school. First of all, because their populations are quite high. There are a lot of people competing for those places. In Zambia, there are very few of you competing for these places. Like I said before, there are advantages to disadvantages, right? So being here, you may earn less money than those that are abroad, but you have more opportunities here in Zambia for research and for publishing papers. Because when you live in Zambia, you're under the Hinari system, so you can publish without paying a lot of money for it, right? So you get these exemptions because you're coming from a third world country. So professionally speaking, there's an advantage of you working here. The disease profile here in Africa is, the spectrum is quite huge, right? It's quite huge. So if you're looking at HIV, for example, you will see a lot. The spectrum is quite huge because these patients, some of them have been untreated for a long time, and this is why Dr. Asobang was here looking at GI pathology here, right? Because it's quite different. It's number two. If you are in Africa, if you are in these developing countries, you get the chance to redesign systems. I'll tell you, in the UK and in Canada, they would love to have a medical examiner system running death investigations. But there's a tradition. They've had it for over 100 years. They're not going to change overnight. When you are in Africa, you can be able to push for laws to change, for systems to change. Now that is a very big advantage because then you work in a system that you've designed yourselves, okay? That is relevant for this particular time, as opposed to things that are there that are cast in stone, even though you know that there's a lot to improve, right? So for example, in the UK, Dr. Harold Shipman, a serial killer who was a doctor, killed a lot of people, a lot of his patients, and was convicted. But it took a long time to catch him, right? But they haven't still changed that system of their death investigation, all right? They're trying to change it, but there are a lot of people who are conservative, right? In Zambia, as we speak to you right now, we've changed the law for medical legal death investigations, right? Because we are few, it gives you the opportunity to speak to things and people will listen to you, because you're, first of all, you are fewer. Even if you are 15, you are still few, would still push an agenda, right? But if you are in a developing country, if you are in a developed country, there are a million of you, million people around you. There's everyone who's arguing with you around things. So there are a lot of advantages to working in Africa, especially in your own country, where systems, you have the liberty to change what you don't like. There are a lot of people who work in environments they don't like. They like the profession, but they don't like the environment. In Zambia and in Africa in particular, you have the chance to change a system. Believe me, you ask our colleagues in the US, you ask Dr. Asobang, you ask Dr. Cheng, it's very difficult to change systems there. But here in Africa, no, it's a bit easier. It's a bit easier because we're still developing a lot of systems. So working in Zambia might not pay us the most money, but we've gotten the satisfaction also from the fact that we're able to do research easily. We're able to access samples very, very easily. And we're able to write about things very, very easily because these are uncharted waters in Africa, right? So research is uncharted in Africa. The type of cases that you see, it gives you very huge experience. So I'll tell you, an average forensic pathologist in Canada, for example, I'll speak about a place that I know. By now, by the time they retire, they would have done 4,000 cases, right? 4,000 autopsies. In Zambia, when you work for 5 years, you would have done 2,800 autopsies. The experience is huge, right? And I'm happy about that. I'm proud of that record. And I want to work here because it makes me understand things better. I'm more satisfied as a professional working here because, first of all, I'm seeing a lot more cases. I'm able to do, so you remember what Dr. Cheng said just before me, that working in the Caribbean and also working here, you get to see cases that would never, that if you work in the United States, they'll never be given to you because you're a junior pathologist, for example, right? So there are cases that will be reserved for very senior people. But here, no, we're getting all that experience. We know that we're making mistakes. We are very conscious of that sometimes we make mistakes because we're not very experienced, but we are happy to have the opportunity to deal with very difficult cases because we're here. And that's what I'm talking about, the advantage of disadvantages. It exposes you to things that you would not normally be.
Thank you very much, Dr. Cheng. Your mic is muted.
Okay, sorry, Derek. Sorry. Thank you so much, Derek. Your question was very strategic, and it's taken my soul out of me. Like I've poured out my heart to you today.
Yes, thank you very much for that. In view of time, we'll just ask you the last question, so we can just wrap up the session. What is your typical day like as a forensic pathologist? What do you do during your during the day? What are your day-to-day activities? And besides your life as a pathologist, what do you do in your own free time? What do you do?
All right. Let me start with my free time, because that's very precious for my mental health. It's very important. So I am an ardent amateur cyclist. I cycle a lot, 200 kilometers, 150 kilometers every weekend. That's lovely. So I do that a lot. When I am on my bike, it gives me a me time. I'm alone. No one disturbs me. I can go through everything in my mind. So that's a very important thing for me, because I realize that I see a lot of trauma. I mean, like loads of trauma. So for example, I see people who come in beheaded, one part of the body is in a sack, a head alone, and the body alone, hands chopped off. It can be very traumatic. So you need that time alone to process things. And so being on the bike 3 hours, 4 hours of a weekend, sometimes 6 hours, 7 hours of a weekend is a very important aspect of my life. And I deliberately block out that time to be able to keep my mind healthy. So that's a mental health thing, and it's a very important thing. You can't neglect your mind. As much as you are making sure that you don't get COVID, also make sure that you don't neglect your mind so you don't break down. That's one thing. So my duties, what is my typical day like? My typical day is very busy, and that's because it's loaded because I'm alone and I do a lot of teaching. So on a typical day, I start my day at 4 in the morning. I wake up at 4 in the morning. I make sure that I do some continuing medical education for myself from 4 to about 5:30. So I'm reading some articles in forensic pathology, 4 to 5:30. After that, I get to work. At 7 hours, I have a lecture with the first year postgraduates. So I teach them basic pathology. So 7 hours to 8 hours, I have that. Then 8 hours to 9 hours, I'm in the mortuary setting the day, planning the day. I set out what needs to be done when. I then give instructions to other pathologists who are working with me, and also the postgraduate students, the pathologist residents. So I also give them tasks to do. That's between 8 and 9. And then 9, 10, we start our work. So we're in the mortuary. When we're in the mortuary, when we're doing these death investigations, most of the things that we do is the police officers bring the cases, the detectives, and my job is to basically advise them. So I'm a consultant to the Zambia Police Service. So I give them advice about how the person came to die, what evidence has to be collected, what should be collected, how should we do it. So I spend a lot of my mornings doing that with the police officers. And then I also spend my time with the relatives, explaining to them why their loved ones die, because we have to respond to that. Other times I get infectious diseases that are unexpected. And so I have to communicate with public health, because there are diseases that I have to inform them all the time. So if I find TB, if I find COVID, for example, I have to communicate with public health. So I do that a lot. And you'll be shocked, I see a lot of TB and a lot of infectious diseases that are unexpected that I have to report, right? So, and then over lunch, so 12 to 13, again, I'm not fully employed by the university, but I do a lot of teaching. So 12 to 13 is my teaching time. I want to use my lunch time to teach. So 12 to 13, I again have a slide session in anatomical pathology with the residents. So I just show them my teaching set and share with them a few cases that I've seen over my short experience in anatomical pathology. And then the afternoon, I spend it writing postmortem reports. So I write postmortem reports, maybe 2-3 hours every day. And then I also, depending on the day, I spend a lot of time also doing administrative work. So I'll be at the Ministry of Home Affairs, attending to policy matters and budgeting and all that kind of thing. So I do a lot of administrative work as well. It's very overloaded, and this is why I'm happy to hear that people like Derek are planning to become pathologists, because we need a helping hand. We are happy that we are mentoring people right now. We are mentoring pathologists right now who want to join forensic pathology. And I am hopeful that in the next 3-4 years, we'll have a lot more forensic pathologists in the country. 3-4 is a lot more, because everywhere in the world, including the United States, we don't have a lot of forensic pathologists, formally trained forensic pathologists, based on the numbers of the population. So that's my day to day. But then after hours, I have to find time to write, to contribute. So if you teach, you must contribute to writing. So I have a team with a few colleagues of mine where we we try and stay late after work and try as much as possible to contribute by publishing. So every day from 16 hours to 19 hours Zambian time, we try to use that time for research work. Not that we have any grants, but what we do is we say, what can we write with the data that we work with? So every day we do postmortems, right? We do autopsy work. But that data is not helpful in its own as a single report. So what we do is we aggregate this data. So this year we've done, for example, in fact, in the last 5 years, we've done 192 cases that have showed us that there are structural pathologies within the heart. So we want to write a paper about that, but it's not a study that's funded. This is data that we generate as we work, more like operational research, right? So every day I get into the office at 7, I knock off at 7 in the night. Why do I knock off at 7? Because there's a portion of 3 hours where we sit with our team of other pathologists where we're trying to find out what can we write, what can we do to inform the world about what we do, and what is our data telling us. So we aggregate this data and try to see if it tells us something. So we've taken on a more a value-added autopsy, so that can inform public health, but it can also inform policy. So for example, just 2 days ago, we were trying to push out a paper that talks about how we can cope in view of the fact that we don't have forensic pathologists. How can we use general medical officers to help us in death investigations in the rural districts of Zambia? Getting an example from what they do with traditional birth attendants, understand? So it's all these things. It's loaded, but we enjoy it. We love it. This is what we're meant to do. And we think that it is a productive way of contributing to pathology. And don't get it wrong, we very, very strong family ties. I spend a lot of time with my kids. It's just that I spend a lot of time with my kids after 19:30, after 7:30 p.m. So 7:30 p.m. to 9 p.m. is kids' time, right? I have to be with my family. We sit down and they ask me all sorts of questions. I always make sure that we have supper together all the time. So supper is 20 hours. All of us are sitting on the same table eating. So yeah, it can be busy, but there's still time for me as a person, but also for family. Thank you.
Thank you very much for that, Dr. Mucheng'anga. You are really indeed a great inspiration to me and to others. I'm sure would have, if we had enough time, would have asked all the questions that we had, but at least we now have a general view of what pathologists are and what they do, and the types of pathologists, and literally basic things about pathologists. So thank you very much for sparing your time to be with us, to have a conversation with me through the Pan-African Organization of Health Education and Research. So thank you very much. Thank you also to everyone who's attended this session. We are very grateful. Board members, thank you all for creating such an opportunity for us to interact with specialists and to learn more about pathology. Thank you.
Thank you so much. I know there's some background noise, and I'm not sure if it's my mic. But yeah, I do want to say, whenever we arrange these sessions, we tell the speakers, we're just like, oh, it's going to be an hour, maybe an hour and a half, and then 2 hours later, we're still talking. So, I on behalf of POHER, I really want to say thank you so much, Dr. Mucheng'anga. Really appreciate this. And I think some of the messages he stressed, and I took some notes as well. One of the things about mentorship, and that's what we do as POHER, and Dr. Mucheng'anga offered, about Derek, who's our future pathologist, and they're both in Zambia. Derek should connect with him, which is fantastic. you know, because Dr. Chen is Derek's mentor. And now we've got Dr. Mucheng'anga, who will also, you know, help guide him, which is, you know, brilliant. And then eventually we'll have to loop Dr. Mucheng'anga in as one of the Poher mentors, because we have a, you know, a group of mentors, and we pair students. We take a handful of students a year. So this year we have 10, and each one gets paired with a mentor. And we also have a WhatsApp group. And so the WhatsApp group is basically, you know, they talk about whatever it is they're interested in, and things such as birthdays. And I think, excuse me, today I think it's Sophia Lua's birthday. There were shout outs going on for birthdays and things of that sort. So they also have, as Poher scholars, they have a close network that they work with. You know, we take students from across the African continent. So we're super happy about this presentation today. And so some of the points that you mentioned, and I'll just summarize, I think are really important. Number one, you know, the message was stressed about being proactive. You know, as medical students, things may not fall in your lap, even as you move past being a medical student. The other thing is being determined. You know, what I sometimes tell the scholars is your energy is what's driving us, right, as mentors. So if your scholar or your mentee is not interested, then you, the mentor, might not be interested as well. So you have to be the driving force. Then what I love, the other point you mentioned about systems, I think within our African continent, there's always opportunities for us. We are responsible for Africa. This is our Africa. And so it is up to us to make those changes. So whatever it is that we're learning, it's up to us to go back and make changes that will ultimately improve the care of our patients. You know, these patients could be our relatives, our friends, our colleagues. So this is our Africa, and we are responsible. And so that was an excellent point about systems. Then a really important point you touched on is family first. You know, where you've got the structure where you're doing all this work, but you still find that time. And sometimes it's very challenging, but you made that point. And I loved your point about mental health. You know, sometimes the stigma with mental health, but there's a component of physician burnout. And I loved how you talked about, you know, for you, it's cycling. That's me time. It's okay to want to be alone. Doesn't mean something's wrong with you. You just need that time. I love how you explain, you know, that sometimes you deal with these traumatic things. And, you know, as doctors, we're humans. You know, we have feelings, you know, so you also need to go back and just kind of process what happened. You know, I was smiling when you mentioned the cycling. I'm just like, yeah, I've been on a bike. To be on a bike for that long, things start hurting that I can't do this anymore. But I was just like, you do that. You know, whatever it is that you do to get your mind free, to get your mind relaxed, just pick it. You know, if you love cooking, you know, and I think from our orientation, I think Derek loves cooking, and hopefully I didn't get this wrong. We've got people who love dancing. I think Chani is the one who's going to do the chicken for us when we have our in-person orientation. But, you know, pick what you love and then go for it and use that as your time. Then the other point I really loved you mentioned, which is really important, was about research. So sometimes with research, you won't always get funding, right? So, you know, to try and get out there, we do research because there's information we want to share with our friends, with our colleagues, because that's going to help our community, our society. And it's not for everyone. If you love it, you do it. If you don't love it, you don't do it. But I loved how you mentioned you've carved out time for you and your team, where it's like from this time to this time, this is our time for research. We don't have the funding, but we're publishing this. We're telling the stories. We're telling our stories of what's happening and what we're doing. And I think eventually, you know, like Dr. Chen herself mentioned, she had 5 publications in a year. And I'm going to use this as a shout out to our scholars who have, you know, some have been with us for less than a year, some a year. Derek just submitted his abstract to AOTIC. We're waiting to hear. Sophia Lua submitted one to AOTIC as well. Deborah, another scholar, submitted one to an adolescent conference. Anya's an international scholar who's, in addition to Poher, who's actually coming for, you know, a rotation here. Ivan, who's not on this call, but he was doing neurosurgery before he came. But if you look at his profile, his determination to get to that point. You know, we've got Natasha, who's also done, you know, she's a CEO of HERDS, does the poverty, period poverty, which is extremely important. You know, you've got, you know, Mwenya, who has an interest in OBGYN, Miriam, who's interested in, you know, in public health, you know, so we've got all these, and then Derek, not Derek, but Dave and Kenge, who wants to do GI. you know, and he's also submitted a grant, submitted abstracts, and is working on publications. So you have to make the time outside. So that's the message I got from Dr. Mucheng'anga and Dr. Chen, and that's the message we want our students to get. It's not easy, but just because it's not easy doesn't mean you cannot get there. You know, so reach out, get a mentor. Poher is, you know, always available. I think Anya had dropped some of our, or put a comment about our different social media outlets that you can reach out on. You can follow us and get some information. So once again, on behalf of Poher, absolutely grateful. Thank you so much, Derek. This was fantastic. You had so many great questions, and I know you've got so many more, but we're beyond time. And Dr. Mucheng'anga, thank you so much. Hopefully we can have you back again. We'll have to set up another session because we've got a lot of questions again. And then we'll definitely have you come on as one of our Poher mentors as we start recruiting mentors for our next phase. And then you and Derek will, you know, will connect, and we'll get Derek to be one of our future, you know, pathologists. And then we'll kind of go from there. And just in preparation, our next speaker for next month, some of you know her. She is the CEO of Copper Rose in Zambia, Dr. Natasha Salifiani Kaoma. We'll have more information coming up that we'll share in terms of details. So we're excited to have her come on for our next session. And on that note, Dr. Mucheng'anga, do you have any sort of final closing words that you'd like to, you know, leave upon our students, our young trainees, before we close this session? You've said so much, even if, you know, final words to encourage our students.
Okay, thank you, Dr. Aspen. First of all, the initiative is great. I think it's a very something that I don't regret having that spent these last 2 hours interacting with the very productive to medical education. I'm happy to be of any help to anyone. If anyone wants to be mentored, I'll always be here. Thank you so much.
All right, thank you. And on that note, we'll call the session to an end. Derek, thank you so much. Anya Avis Nobuth, who's also in the background as co-host on fielding some questions. Thank you very much. Dr. Chen, who is on call and is heading to the hospital. Thank you so much for your time. On behalf of Poher, thank you very much, everyone. Good morning, good afternoon, good evening. Have a fantastic day. We'll see you at our next session. And the session is over. Thank you.